I'm so glad you're here. This is a replay of a live training I did inside the OTs for Pelvic Health Facebook group with Lindsey Vestal, and I wanted to make sure that everyone gets access to it. Pelvic health is such an incredibly fulfilling specialty, and it's growing so much. I've been training OT since 2018, and my goal is to have over 10,000 OTs trained by the year 2030. I'm so glad you're here learning about this specialty. I hope that you can join us in the OTs for Pelvic Health Facebook group with me, Lindsey Vestal. I will link to the group below in the show notes and description. Thank you so much.
Hello, everyone. It is that time of the week, OT Empower Hour, where we roll up our sleeves, we get curious, and we ask ourselves all the questions that we need to in order to be the best OT in pelvic health that we can, constantly challenging ourselves and diving into that lifelong learning. Today's topic is exceptional. We are going to be talking about supporting neurodiversity in pelvic health. Sorry, my screen just changed. I just want to make sure. Does it still say live on your end, Dana?
It does.
Okay, awesome. I'm not seeing the chat, but that's okay. As questions come in, we'll find them. I am so excited to be talking about supporting neurodiversity in pelvic health. I have such a lovely guest today, which I cannot wait to introduce you to if you don't know her already, but I'm sure you have. She's such an active member of our group. Before we get into that, I have to start with our icebreaker question. It lets my guest and I, Dana, know that you're here. The algorithm in Facebook is such that we don't know you're here until we're actually able to see a comment come in. So, and by the way, if you're on replay, you're not off the hook. We want to hear from you. Dana, I'm going to ask you the question first. And that is, if you're going to go somewhere on a trip, do you prefer to drive or fly? It's a tricky one.
I think I prefer to fly.
You prefer to fly. Okay. So Dana says fly. And right now I'm going to say drive, but honestly, the caveat with all of these things is always like,
How far?
Where are we going? Exactly.
Yeah.
That makes such a difference. But you know, these icebreaker questions have to be pretty simple and well, then step B, step C, step D. So Gwyneth, Michelle, I see you guys here joining us. Let us know. Carolyn's joining us. She says fly. Fantastic. Keep them coming in. And of course, on replay, let us know your feelings. Before I introduce my beautiful guest, I have to mention that OT Pioneers is opening next week for the last time in 2022. Doors open on Monday and close on Friday. You have lifelong access, and we have group mentorship calls, and it would be my absolute joy to support you. It is my favorite time of the year when doors open on this.
I am a proud OT pioneer. I took the course at the end of 2019, and it really opened my eyes to pelvic health. It opened doors and opened my eyes, and it really started my career.
Oh, thank you so much, Dana. I love that you're a pioneer. I will drop the URL in the comments if you're interested in joining us. It would be my absolute pleasure to support you. All right, so I got to tell you about Dana. She is an OT who came into pelvic health after years in pediatrics, working across his ages birth to 21 years old. And throughout that journey, she really grew to see that there was a gap in pelvic health services for people across the lifespan. Race, gender, neurospectrum. In addition to seeing clients through pregnancy and postpartum, she also works a lot with clients who have pelvic pain, chronic pain, constipation, and other bowel issues. And her clinical style is incredible. She incorporates education, nervous system regulation, manual therapies, so visceral manipulation, myofascial release. She has an extensive background in yoga and rebuilding movement patterns to help her clients do the things they want to do without hesitation, fear, or pain. Welcome, Dana.
Thank you. Thank you so much for having me. I'm excited and nervous to be here.
I totally understand. I just did a post yesterday about speaking live in person at the Arizona conference tomorrow. It's my first in-person event in 3 years. And I'm jiving with you. I've got all the nerves too. So you and I together our nervous systems will co-regulate, and I think we'll settle into this together today. Awesome. So anyone joining us, please, we love having you a part of the conversation. Any questions you have as we go along, throw them in the chat. We'll weave them in the conversation. I love thinking about OT Empower Hour as a long table of people rolling up their sleeves and asking all the questions we need to challenge ourselves and to remain curious. I will kick off with my first question for you, Dana, which is, what was your journey? How did you start to connect the dots with serving this population?
Yeah, so, I came to pelvic health through pediatrics. So I was working in, I started in early intervention, birth to 3 years old. I started in early intervention.
Sorry, please go ahead.
I was like, how do I hear myself?
There's two Danas.
I started early intervention, and then I worked in a school with children with special needs. I worked in outpatient pediatrics, worked, so I kept, through the pediatric lifespan, I kept going. And then I worked even part-time with young adults with executive functioning deficits and TBIs. So like literal birth to 21 years old and beyond. And then, switched specialties to pelvic health and really thought that, I was only going to do postpartum care. And then I worked at this big clinic and saw 12 people a day. And I started to watch the people that would come onto my caseload. And so many of them were 20 to 27-year-old women or non-binary folks with these similar, I started to see these patterns. It was anecdotal is how I connected these dots. Is these people would come and I'd say they had similar personality traits in the sense of highly intelligent, highly creative, very analytical, very anxious, very disconnected from their bodies, also struggling with chronic pain, pelvic pain, and many of them either actively diagnosed with some type of autism spectrum disorder, ADHD, ADD, or kind of would verbally share, like almost in a joking way, that they have it or should have it. And I started to realize these patterns, and I kind of wasn't sure if that was just me, just like my observations, or if there was something to this. Yeah, I find it really interesting. I also want to note that there's a little bit of a demographic bias of my observations. I live in a city with 300 different college institutions around me. I live in I work in a neighborhood where there's 2 Ivy League schools. So I want to acknowledge that there's definitely a demographic bias coming to play here. But so I started to do some research because the evidence-based OT in me needs that, and found that there's actually a really high correlation between especially women who are neurodiverse and hypermobility and chronic pain.
That is incredible. How did you come across this research? What were your steps to find this evidence?
An in-depth Google search that led to articles that are honestly, most of them are under 5 years old. There's not a lot of research.
Yeah. So then what was your next steps, right? So you're this incredibly curious OT who is finding these patterns, dived into some research. What was next for you? What was that next stepping stone?
Well, I had a moment where I was like, wow, my career just came full circle. I was working with my little low tone babies. Then I was working with my not very coordinated kids. And then I was working with the executive functioning piece. And now I'm working with these these hypermobile women with chronic pain. Like it all came full circle. And I took the approach that I took with everybody else in my career, tapping into a lot of nervous system regulation, sensory somatic experiences, getting people into their bodies and getting comfortable with the sensations that come up in their bodies. And almost giving, like, kind of switching the belief system of like, there's a sensation, I need to be afraid, and rather let them explore the sensations almost like the very analytical scientific people that many of them are, almost like with a sensation that they're the scientist of their bodies.
Oh, I love that. I love that phrase. And I love how firmly you dug into your OT roots there, because by doing that, you were able to go into interoception. You were able to go into that yoga background that I know so much about with you and your experience, to move them into embodiment and maybe some lack of disassociation that can come along with that analytical brain, right? Where we're always trying to solve that problem. We're always trying to get to the next thing. And if we lean more into that, it can often create more of that anxiety, which will only, serve to take them down the path they're already going. So beautiful, Dana. Such an incredible combination of leaning deeply into your OT roots, to make those connections. And Michelle is joining us and she says, yeah, great connections, incredible development of ideas, and being a witness to your practice while continuing to serve, and recognizing that the skill set you had was there available to you and able to serve whoever was coming in your clinic that day.
Yeah. And I think that as OTs, we all have these skills, right? Like I don't think you need to go out and take another course, to be able to support this specific population. I think that everybody is utilizing these skills in different ways. It's just about putting together those pieces when you do start to notice, whether it be, someone coming in with a diagnosis of, someone who is neurodiverse, or, demonstrate signs of it.
Yeah, that's great. That's an excellent point. That we're already equipped. We have that skill set already. That's lovely. I'm curious, where you've talked about this a little bit, but I'll just ask it in a more direct or specific way, which is, what are some of the most common pelvic health symptoms that you were noticing with your clients?
I would say that most of these people came to me with pain, right? Like pain with sex, I see like symptoms. But other comorbidities that typically would come up is, I would say, everybody had GI issues that came along with it. All of them had some type of, there's hypertension in the body. There's muscular tension, especially around the pelvic floor, but tension throughout the body. And I also noticed that there was just general hypermobility. Maybe, I was doing some research into this. Like, I'm not going to say like EDS level, but along that spectrum of, joint mobility, these people lend themselves towards that more bendy body.
Yeah. And then when you actually are in the session with your client, what are some of like the intake questions that you're asking, or observations that perhaps you started witnessing?
Well, I think it's important to know that I'm not making this quick decision about somebody in one session, that this is something that evolves over time. Many conversations, many sessions. Sometimes, you see it on someone's medical history, they'll write down that they have ADHD, or you'll see in medications that, you always want to do your research on, like, when people write down their medications, what are they taking? And sometimes I have a conversation on why, and if they have support around those anti-anxiety or SSRIs, to kind of get more information into why they're taking what, because there's so many women that are diagnosed with general anxiety disorder that are also, there's a diagnosis around ADHD and generalized anxiety disorder. So I always like to just get more information into their medications. I'll ask questions around if I feel like they're a little hypermobile. I'll ask if they've ever been told that they're flexible, or if they are double jointed, if they tend to dislocate, tend to dislocate joints easily. I'll ask if they would call themselves clumsy, or if they find that they fall a lot. Things like very like open-ended questions.
Yeah.
Other things is really about observation, which is why it comes from so different, you're not going to walk away from an evaluation with this full picture of someone, but
Yeah.
I like to see how they relate to their bodies while doing manual work. I like to see how they follow verbal directions. And it could be something as simple, as, you're doing like a single leg raise, like what, how are they doing that? What are they doing when they, can they follow your verbal directions? How are they moving their bodies? But also the nonverbal communication. How are they making eye contact? How are they, are they able to keep, maintain like boundaries within the conversation, and how are they maintaining those boundaries within conversation? Just really a lot of nonverbal communication to see, just starting to form that full story of a person.
Yeah. Yeah. That's incredible, Dana. How about treatment? What are some treatment considerations that you found yourself kind of coming back to?
We talked about this a little bit. My general style is really getting people into their bodies. So I've found that tapping into that interoceptive sense and those proprioceptive senses can be really beneficial for these folks. Using active dialogue within manual therapy, so you can really start to bring attention to these places in their bodies is important. Just so they're, it's easy to get into your head. It's easy to disassociate. So just really starting to notice letting them feel into the sensations around their body. Doing a lot of nervous system regulation. A lot of pain can be triggered through anxiety, especially within these folks. Some research recently showed that people who are neurodivergent are more likely to experience anxiety around pain and anxiety related pain. And so tapping into stress management can be really important here. And also getting into functional strengthening and getting them to really, especially those that have chronic pain, tend to be a little bendier, tend to lean towards that hypermobility. You really want to focus on strength and them feeling that heavy work.
Yes. Yes. That's so key, so crucial with that clientele for sure. And I find that also really helps with that interoception, because once they start feeling that groundedness, that strength building can do, that stability, it starts to take the tension off the other parts of the body that maybe we're trying to do more of the work to compensate for that hypermobility.
Yeah. Yep. And I mean, it all comes back to core strengthening, really, which we use so much within pelvic health. These folks need it. Just even if someone's coming for pain, a lot of times core strengthening can be so important.
Yeah. So it sounds like, oh, please go ahead, Dana. Go ahead.
Oh, I was also going to say, I think multisensory learning has been pretty key. I utilize videos, videos, handouts, different resources that can be offered so that everybody can really, I can tap into everybody's learning style.
Yeah.
Which I guess is another intake question, is that I'll have a conversation with everybody about what their learning style is.
Yeah. Yeah. And I could imagine that sometimes opens up a can of worms, because I think that a lot of adults aren't even sure themselves, right? I mean, honestly, I don't think it was until I was in grad school at NYU that I was an older student. I went to graduate school in my late 20s that I even learned my learning style, right? And there isn't a whole lot of focus on how to learn. It's just learn. You're expected to know this. So I imagine that's a bit of an evolving question as well.
Oh, absolutely. And not everyone's going to have like the I'm a visual learner answer.
Yeah.
But sometimes it actually brings up, well, in school, it was actually kind of hard for me. I hated this stuff. Like it kind of would evolve. The conversations would evolve. But offering different ways for someone to learn, because the idea that in a 60-minute session, someone's going to get out everything that we've discussed is pretty impossible for anybody.
Yeah.
So giving them bits and pieces to be able to refer back to is important.
Awesome. We have quite a few people joining us, so please throw your questions in while we have Dana live. Of course, she's a member of our group and she'll be around if you have questions, but throw them in. And as I was saying that, Carolyn hit enter and she's got a question for you, Dana, that I'm gonna go ahead and ask you, which is, for those neurodivergent, do you use CBT frame of reference for anxiety and stress management for interventions? Dana?
Not explicitly. I think it depends on the person and what their goals are. Sometimes it's really about helping them be embodied. But if I start to notice things like if conversations about home programming is really hard to implement and certain things become difficult, like then we'll start to break down tasks into how can, like, creating systems. And I don't know if this is exactly what answers your question, Caroline, but I have found that nobody likes to be told how to do things. They need to create it for themselves. And this group especially does really well when they see it with their own eyes, what's going on. They create their own systems. I don't know if that makes sense, but
I just think that's such an important part of what we do with every population, because when we lean on them for the wisdom that they have, right, they're the experts of them. We're there to support them, but they're the experts of themselves, and we're there to empower them and encourage them. But I always say this, they have the answers inside of them. And when we hold that space for them to find it, which is not done in healthcare very often, those systems can come into place. And that empowerment that follows, I found this, I discovered this with Dana's support, is the thing that's going to carry them forward well beyond working with us. And I personally feel like that's what it's all about. That's the heart of good therapy, in my opinion.
yes. And that's, so sometimes, I'll have people track their pain or track their bladder bowels, and then we can create systems around what they're finding. And it feels like a partnership.
Yes.
Rather than somebody trying to insert something into their lives, and it's way more likely to stick.
Yes. Carolyn says that makes sense. She said, I guess when I hear anxiety-driven pain and or catastrophizing, that CBT or cognition-driven behaviors that are associated with pain is where I thought it might be helpful.
I think that everybody's skill set is really different. My background leads me towards getting someone into their bodies, looking at the task at hand that could be triggering some of that anxiety, and seeing like, where can we place breaks and sensory experiences into the day that can help manage that nervous system response.
Yeah. I love that. Keep the questions coming in if you have them.
I love it.
I have one more myself, and this is something that Dana, you and I have talked about in the past, and I think it would be a beautiful conversation to bring up now, which is how potentially ADHD presents differently in women than men, and how it can often be misdiagnosed as anxiety.
So I'm trying to see where I had a little research written. So there's like I said, there's not a ton of research on this. So I did a little digging. Women and girls with ADHD are more prone to have difficulties with the inattentive symptoms versus that hyperactive impulsivity that a lot of boys and men with ADHD and ADD have. So they, they kind of fall, I'm losing the phrase right now, but they fall between the cracks.
Yeah.
And so a lot of women aren't diagnosed till much later in life. A lot of times, like well past grade school, past education. It's usually, in comparison to the male counterparts. And then a lot of times women have more pain symptoms than men.
Okay. Yeah. We need so much more research on this area. It's so well needed. Carolyn is wondering, what interventions do you like to help improve a client's interoception? You mentioned active dialogue.
Yeah, so it depends on what, there's lots of different ways, right? If they're coming to me for, bladder and bowel issues, I'll ask, like, what does it feel like when your bladder is full? What do you notice? Starting to really ask questions and get specific, which, that's a hard thing to answer. So it's usually something that someone has to come back to me with, but just starting to get curious about what things feel like in the body. What does it feel like, when your body is relaxed and calm? What do you notice in your body? Just starting to really tune in and ask questions. I do this during manual therapy, like during myofascial release. I'll do it during internal or external work. I'll do it even during movement or during restorative yoga, of just what's coming up for you now. What are you sensing? What do you feel? What's your body coming up? What's coming up in your body right now? And just starting to ask those questions, because then those questions lead to things even after the session.
Yeah, and I would love to add on to that, Carolyn, for interoception. I really love to do it outside of the session and outside of the context of their symptom. So I like to do something as simple, especially if someone feels really disembodied or disassociated, like something as simple as hot and cold, right? We all have ice in our freezer, or access to cold water, access to warm water, access to a hot pack or a warm mug of tea, and just simply asking them to come in contact with that temperature change, and then to do a scan to what changes and where they feel that sensation. Or maybe it's just in their hands. Maybe it's just comfort. Whatever emotional response and physical response is co-occurring, right? And then I find changing over to the next, say they started with cold, changing over to heat, it allows them to feel contrast. So a lot of times interoception is about building in contrast between sensations and recognizing the states that differ in those sensations. And once that starts to happen, it opens up so many doors for them to then be able to dive a little bit more into perhaps what there was a lot of fear and tentativeness and anxiety around, which were the sensations that most people are trying to avoid: the pain, the tension, the looseness, the potentially the ability to fall or be clumsy, right? I've done a whole OT Empower Hour on interoception, which you can find under the files tab on the replays. It's one of my very favorite topics, especially as it relates to pelvic pain. That was a great question. Awesome. Anything else? Does anyone else have any other questions for Dana? This has been a fantastic topic, and I've loved learning about your journey. Carolyn says, thanks to you both. Love those ideas. Awesome.
Yeah, thank
Dana,
you so much for asking.
Oh yeah, yeah, it's beautiful. So as I'm waiting to see if any questions come up, I'd love to know, what are some of the things you're working on these days?
Yeah, so I am working on developing these tools for other therapists to use with their clients. I'm making a lot of resources and even developing a resource library. I'm really excited about this because I feel really strongly about this multisensory learning approach, that we can't expect our clients, as smart, as amazing, as, motivated as they are, we can't expect them to leave a 60-minute session with all of the information we're giving them and what they're processing in their bodies. Like there's just no way.
No.
So, I'm making these resources that are, with custom, beautiful illustrations and going over things like, pelvic health 101 and being able to share these with your clients, bladder habits. I did one on pelvic floor relaxation, which is the newest one that I'm really excited and love. And I even created a bowel bladder diary that I think is, I really dislike most bowel bladder diaries. They've been giving me headaches for 3 years, and this is the first one that I really enjoy using.
You created the resource that you needed.
I created the resource that I needed, and I think that it really allows the therapist to not just see like a mess of the numbers and data, but also allows clients to really understand how to use it and see the data themselves. So that's been really fun. And when it comes down to it, we're, as therapists, we're not the professionals of Canva. We're not supposed to do that. Like, that's not what we went to school for. And a lot of the information out there is everywhere, right? There's so much information about pelvic health, and I want to create a space that it's kind of all in one spot, so that busy therapists don't feel like scattered, don't feel like they need to spend valuable time making things or looking for things, that it's really in one beautiful, organized spot, and they can customize it with their logos and look like the amazing professional therapists they are.
Well, what I love about what you're saying is like, why do we need to reinvent the wheel? I think so many of us have struggled with the handouts that are available out there, the resources that we have to collect from this spot and this spot and bring it through here. And it's like, we're all doing this. So
we're all doing the same thing.
We're doing the same thing and struggling with the same issues. So this is definitely something that needed to happen, Dana. And I can't think of a better person to have stepped in to fill that niche. So would you mind dropping in the comments when we finish today where people can go to find these resources?
Yeah, so I will absolutely drop the my resource shop in a link for that. And I have a couple like these bundles. So if you purchase a bundle, you actually get free access to the entire resource library, which has my 20-page guide on postpartum recovery and a 10-page guide on a cesarean recovery that I worked on with Laura Rowan, and different articles and videos. And it's just so quickly expanding that I really hope for it to be an amazing one-stop shop kind of deal.
Gwyneth was wondering if you sell your voiding diary.
I do. Yes. So you can purchase it with a bundle, or you can purchase it on its own.
Awesome. Awesome. So would you prefer people to DM you, email you? What's the best way to kind of, for them to find this out?
You're welcome. I'll leave my email address. I'll leave a link.
Perfect.
And if you want to DM me, you are welcome to DM me, but I'll leave all that information in the comments section.
Awesome. That sounds beautiful. Thank you so much, Dana, for joining us today and sharing your wisdom. Tracy adds, they are such good value and a very amazing resource. So Tracy, awesome. It's so great to have someone joining us.
Tracy.
who has used Dana's worksheets and resource library. So thank you, Dana, for sharing all of this with us today and bringing such a refreshing perspective to OT Empower Hour.
It is always fun chatting with you, Lindsey. Thank you so much.
Quick reminder, OT and Pioneers opens next week, Monday through Friday, closes on Friday. It would be my absolute joy to support you in your journey to becoming a pelvic floor therapist. Can't wait to see you all next week. Have a beautiful day. And thank you again, Dana.
Bye.